हेलो गुड मॉर्निंग, मैं सिर्फ डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के कार्डियोलॉजी सेक्शन के सम इम्पॉर्टेंट एमसीक्यू। अ 45-year-old male with hypertrophic cardiomyopathy present with increased exertional dyspnea and chest pain. The patient's symptoms worse despite receiving nitroglycerin at the hospital. There is a subsequent drop in blood pressure and the drug is stopped. Further evaluation confirmed dynamic left ventricular outflow tract obstruction caused by nitroglycerin, which drug is not contraindicated in such patient. The left ventricular outflow tract obstruction in hypertrophy obstruction cardiomyopathy in this patient was with the administration of nitroglycerin, a vasodilator. Propranolol is the drug of choice for managing patient with SCM. Here the answer is verapamil. And the verapamil is also a CCP calcium channel blocker that can be used as an alternative to propranolol, particularly in patients who cannot tolerate beta blockers due to conditions like asthma or COPD. Next question. A 35-year-old male present to the clinic due to EG bruising, fatigue and bone pain. He has a history of frequent infection. On examination, he has hepatosplenomegaly. Laboratory test reveals a low platelet count and elevated level of glucocerebrosidase in the blood. The condition is a lysosomal storage disorder caused by deficiency of glucocerebrosidase, which cardiomyopathy is associated with this disease. Hypertrophic cardiomyopathy, diabetic cardiomyopathy, restrictive cardiomyopathy, and arrhythmogenic right ventricular cardiomyopathy. Here the symptom of the Gaucher disease, and the Gaucher disease is a restrictive cardiomyopathy. Gaucher disease. Gaucher disease is a lysosomal storage disorder caused by a deficiency of the enzyme glucocerebrosidase, can lead to the accumulation of glucocerebrosidase in various tissues, including the heart. This accumulation in the heart can cause infiltration and fibrosis of the cardiac muscle and other structures, leading to the development of restrictive cardiomyopathy. And in the hypertrophic cardiomyopathy, occurs due to the MYS7 mutation. And in diabetic cardiomyopathy, seen with alcohol, viruses, and Duchenne muscular dystrophy. Next question. A 30-year-old male present to the clinic due to exertional fatigue and difficulty breathing for the past few weeks. His blood pressure is 150/90, rate 18, and respiratory rate 16, SpO2 98%. Examination reveals a dichrotic pulse. Which of the following changes can be seen in this disease? Here the dichrotic pulse with exertional dyspnea indicated dilated cardiomyopathy. The correct option is increased EDB, increased ESP, and decreased contractility. Increased in the diastolic volume. DCM is characteristics enlargement and dilation of the left ventricle, which leads to an increase in the volume of blood filling and ventricles during the diastole, resulting in increased EDB and increased in the systolic volume ESB, as the heart ability to contract the pump blood in the impaired in DCM. The left ventricle is less effective in ejecting blood during systole. This result in an increased residual volume of blood remaining in the ventricle at the end of the systole, leading to the increased ESV. That is the causes. And next question. A 34-year-old Premegioda at 37-week gestation come to the physician because of a 1-week history of progressive fatigue and shortness of breath. On examination, there is a Vibrissae lung, crackles, jugular venous distension, and 2+ pitting edema of the lower extremities. Urinary lysis show 1+ protein. Echocardiography show left ventricular ejection fraction of 0.35. Which of the following statement is true regarding the most likely diagnosis? The most likely diagnosis is the peripartum cardiomyopathy occurs within the 6 weeks after the pregnancy, because the peripartum cardiomyopathy is characteristic by the development of idiopathic heart failure with reduced ejection fraction month after or before birth. It is diagnosed based on a left ventricular ejection fraction of 0.45 on echocardiogram and is the absence of other potential causes of heart failure. And in the most patient experience partial or complete postpartum resolution of heart failure within 6 months of delivery, but other requires continued management with heart failure medication, devices or heart transplantation. Thank you and keep revising.